Hey, everybody. Okay, Tina here. Ladies, I asked you a question, actually gave a poll, right? About GLP-1 medications in this group, and your answers told me lots of things because some of you were curious but completely overwhelmed. Some of you worried about the potential side effects, and some of you automatically assumed that you couldn't afford them. And some of you just didn't know where to start. And here's the funny part. Not long ago, I probably would have picked one of those same answers. I was a GLP-1 non-believer because I thought GLP-1s were for weight loss injections only. Period. The skinny shot, eat less, lose weight. And I was so focused on the potential negatives that I wasn't paying attention to where the science was going. Well, I want you to know I'm paying attention now. And ladies, this conversation has gotten so much bigger than weight loss because GLP-1 medications actually started in diabetes care. Then we started hearing about them about obesity, but now researchers are studying and using this class of medications through a much wider metabolic health lens. And I want to share some of this with you because I think this is where the conversation gets interesting. Like we are talking about heart and cardiovascular health, kidney health, insulin signaling, our metabolic health, our visceral fat, fatty liver disease, sleep apnea, inflammation, and osteoarthritis and joint pain research. There's even emerging cancer research, and then cravings and addiction research. So now, before somebody comes after me in the comments, I'm not saying GLP-1s are approved to treat every single thing. Right? But some of these are established as good medical uses. Some have major clinical trials behind them, and some are just still emerging areas of research. But that's exactly my point. The research is moving forward. The conversation is changing. Let me give you a few examples. In the SELECT trial, semaglutide was associated 20% reduction in major cardiovascular events in a specific high-risk population of overweight or obese results, right? They did not have diabetes. 20%. That's not weight loss conversation anymore. And then there's the FLOW trial, looking at people with type 2 diabetes and kidney disease. And the study showed 24% lower risk of any major kidney or cardiovascular outcome. Like, that's not about the scale. So what about obesity-related heart failure? Showing of symptoms and physical limitations. The tirzepatide research shows major improvement in sleep apnea with patients with obesity. And now they're looking at knee osteoarthritis, where pain and physical function are improved. Weight loss absolutely plays a role in some of these outcomes. And of course it does. Less mechanical pressure on the knees helps, right? Reducing visceral fat, improving our metabolic health. But the researchers are studying these effects that the medications have on inflammatory pathways, insulin signaling. And this is like the crazy thing. My brain starts going crazy because when we talk about menopause, what are we constantly talking about? Changes in body composition, visceral fat, insulin resistance, metabolic dysfunction, cardiovascular risk, inflammation. I've spent years telling women, or I haven't, but doctors have, just get over it. It's menopause. This is what happens. But now medicine is asking better questions. So instead of waiting for metabolic disease to progress, we can start looking at our metabolic health earlier. I want to talk about the research that I know will get everyone's attention. The emerging research with GLP-1 medications and cancer outcomes, including breast cancer. And I want to be really clear. I'm not saying GLP-1s prevent or treat breast cancer. What I'm saying is research are seeing associations in large studies that are interesting enough to warrant more research. And when you understand the relationship between obesity, hyperinsulinemia, chronic inflammation, and certain cancers, you understand why the researchers are paying attention. And then there's the addictions and the cravings, alcohol, nicotine, other addictive behaviors. Researchers are studying that the brain's reward pathways are helped by the influence of GLP-1 meds. Again, emerging research. But do you see what I'm trying to tell you? This is not just take a shot and get skinny. That's the part I was missing. I am willing to say I was wrong because I would rather change my opinion because I kept learning, then stay stuck in the old opinion because my ego wouldn't let me evolve. But here's where my thinking changed. I started asking myself, some women are afraid of GLP-1s because of the medication, or are they afraid because of the stories they've heard about how the medication was used? Because every woman's body is not the same. Her metabolic health isn't the same. Her muscle mass isn't the same. Her health history isn't the same. Not the same goals, and her response won't be the same. So why would we expect every woman to need the exact same approach? That's when I started learning about personalized care, starting lower doses when appropriate, moving slower when appropriate, and having clinical conversation around low dose or microdosing approaches for different individuals. So microdosing for GLP-1s and longevity is backed by major clinical trials, right? I want to be very clear about that. But individualized dosing, working with a healthcare provider who actually monitors your response, that is so amazing. And because I don't want a healthcare provider who just says, here's the medication, here's the standard schedule, see you later. I want someone looking at my health history, my goals, my symptoms, my response, my muscle mass, my metabolic health, and then help me determine what's appropriate for me. At 62, I'm incredibly proactive about my health. And as a menopause educator, I believe I have a responsibility to stay current with science, not the stigma, not the fear, not what we thought we knew 5 years ago. Medicine is changing. The GLP-1 conversation is changing, and women health educators need to be willing to keep learning right along with it, because this is becoming a much larger education and conversation than weight loss. And I, for one, am paying attention. I bet some of you are sitting and thinking, okay, Tina, but where the heck do I find a healthcare provider who will actually look at me and personalize this for my body? Well, I think I might have that covered for you. If you want information on a telehealth option that can actually have this conversation with you and look at an individualized approach, raise your hands in the comments. That's it. Just raise your hand and I'll make sure you get the information so you can learn more. Ask your questions and decide for yourself if this is a conversation that you want to have. Okay, guys, I hope I helped. I have a really great little info link too that I'm happy to share with you about the changes and the benefits of GLP-1s right now, using them for all those different things and not just weight loss. That's the added bonus. Okay, take care.